I'm Dr. Brent W. I am one of the orthopedic surgeons here at Steindler. The typical hip replacement patient usually is someone in the middle age range, in their 40s, 50s, or 60s, sometimes older, sometimes younger. And what some people don't realize is that your hip is much more of a anterior or front of your body kind of structure. So a lot of people with hip arthritis, which is usually the condition that leads to hip replacement, have a lot of groin pain, or more up in the front, not so much in the back or in the buttock, but kind of more in the front. And stiffness is something that they tend to have as well. So when the pain becomes more severe and limiting, that's usually when we start thinking about surgery. Which even though I do it all the time, it's still a pretty big deal. It's not like getting your hair cut. So a hip replacement surgery is for someone that's disabled or limited by their pain, where it's hard to work, hard to stay active. Hip replacement surgery is an inpatient procedure, at least for us here. Usually about a 2, maybe 3-day stay in the hospital. And it really is something where we reconstruct the joint. So we essentially cut out the old top of the femur bone and replace that with an implant. So on the femur side it looks something like this. So this is something that goes internally into the femur bone, and we tend to use uncemented technology these days, so it's got a metal coating that the bone grows into. So this is what gets fixed into the femur, and then on top of that we'll put a head ball, so we can kind of rebuild the ball side of the ball and socket joint. And then on the pelvis side, or the acetabulum, we rebuild with another metal prosthesis, and there's some holes in it that we can put screws in to help fix it in place. And then inside of here, we would snap in a plastic liner, and that's what rebuilds the joint. So it's one of those things that works very effectively. The expectation for most people is to spend 2 or 3 days in the hospital. We'll get you up right away, with therapy, in the hospital, walking within the first couple of days. It's one of those things for recovery that most people are doing most things probably by about 4 to 6 weeks after surgery. That's walking without any assistive device. That's off of pain medicine, driving a car, getting back to being pretty active once again. And in terms of the long term, it's one of those things that we think should allow you to be very active. Get back to swimming and biking, and even skiing, playing tennis. Anything short of running and jumping and heavy lifting is what we think you should be able to do, having had your hip replaced.